Hi, welcome to the award-winning Ed Brown Show. And it gives me great pleasure to bring you the Maryland Oral Surgery Group. Now, this is headed by Dr. Sharon Russell and her husband, Mark. Hey, terrific combination. And this is something that most of us need sometime or other, either earlier or later. But this is something very, very special. So whatever you're doing, sit down because, hey, look, these guys are new in the area. They're bringing something that all of us need sooner or later. Hey, Sharon, Dr. Sharon, tell us, what is this all about, this oral surgery group? How did you get involved in? Give a little history of this surgery group.
Okay. Well, the Maryland Oral Surgery Group was initiated and started last year. We saw our first patient actually December 19, 2012. And here we are today. Oral and maxillofacial surgery is a specialty in dentistry that encompasses basically managing the maxillofacial region. So that includes the head and neck and the face. So any trauma-related issues, any pathological issues, anything relating to the oral cavity itself, in terms of wisdom teeth, extractions, implants. We also deal with temporal mandibular dysfunction. I don't know if you've ever heard of T&J problems, people having problems with the clicking, popping sounds and pain in this region.
When you talk too much?
Yeah. We also do reconstructive surgery, orthodontic surgery. So it encompasses a great deal of many aspects of the head and neck. And so that's our focus, is to basically bring people back to, their normal functioning, restore their beauty if it's been compromised. Some of these people were in car accidents, had traumatic injuries to their face. And that's what we do. We rebuild, restore, and make people aware of their oral health. In terms of how I actually got into oral surgery, I was a nurse before I actually became a doctor. I've always pursued an interest in medicine and dentistry. I worked for a nurse for more than 12 years at Massachusetts General Hospital in Boston. Not feeling completely fulfilled and wanted to pursue my childhood dream, which was to be a doctor.
No kidding.
Yes.
Very good.
Yeah. And I had the support of my husband, along with my children, and I decided to return to school and pursue a career in dentistry. And because of my nursing background, it brought a lot of that, it bridged the gap with the medicine and dentistry. It provided a lot of medical knowledge that was necessary for me to be successful. And I didn't want to stop at dentistry because I felt like I had more to contribute medically, because oral and maxillofacial surgery compromises, you're dealing with, compromises, but it deals with a conglomeration of the whole body and the systemic effects that it has on your health. And the last thing I didn't mention is that we do also anesthesia. We're trained in anesthesiology. So we actually sedate patients and put them to sleep.
That's laughing gas?
Laughing gas is a form, yes.
Right.
It is a form of inhalation sedation. That's one of the forms we actually provide. So we provide oral sedation, inhalation sedation, as well as IV sedation, and local anesthesia for some people who may not want to choose any of those options.
Well, this is fantastic. What about Mark? Tell us about your role in this group, Mark.
Well, as the Chief Operating Officer of the Maryland Oral Surgery Group, my job is to monitor the day-to-day production of the company, to manage the people that are on staff. We have on staff, go out and do marketing to the various doctors to try to get them to refer to us as well and build relationships in that area.
Great. Fantastic. Dr. Russell, tell us a little bit more about the things that you get involved in. That most of us, you have something very new. I really want you to explain that.
Okay. Well, first I want to talk about our mission and our philosophy at the Maryland Oral Surgery Group. Our mission is to educate the community. And at the same time we're educating the community about their oral health issues, we want to provide that service in an environment that is spa-like and tranquil. Because oftentimes we go to the dentist and it's scary.
Yes.
So our place.
Why not?
So our place, when you come, it's very comfortable. We have waterfalls, we have candles lit, so the aroma is nice. So not only are you visually seeing something that's really great, then you get the great service from me as well. So, you know, a lot of times I've heard from a lot of patients, oh, a doctor has never explained in detail the way you explain. And I think it's very important as healthcare providers that we inform the public about their oral health issues, because they can have major systemic effects. For example, periodontal disease. So many of us suffer from periodontal disease. A lot of patients, I will see them for the first time. They've never seen a dentist. Primarily, they seek me out because they're in pain. And that's the first they've ever heard of periodontal disease. So I'll play this video for them and let them know about basically their gingival and their periodontal, which is the bone, health. And they're like, wow, I have those symptoms. And no one's ever explained that to me before. I've ran away from the dentist because I was fearful. And if you read, you know, our reviews and you see what people are saying about our group, you know, we've transformed people mentally, because a lot of people psychologically have been you know, kind of just misled in terms of what they experience when they go to a dentist. They think it's just a traumatic experience, and it doesn't have to be that way with all the new technology that we have. So when we talk about the different technology, you know, things are really changing and moving forward, especially from an IT standpoint, especially from digital radiography. Before we used to do they would take the x-rays and then we would have to hand develop them. Now with the new technology, we have all this digital imaging, and we can actually do a lot of our surgery, and it's planned ahead of time, and we don't even have to lay flaps. For example, we use that technique when we're placing implants, and anyone who needs implants. We can do it, we call it guided surgery, where the treatment is actually planned in advance. You get a scan on the patient, and we can see in 3 dimensions exactly where the deficiencies are in the in the maxillofacial region, the head and neck region. And then we can plan appropriately these procedures to get you back to your normal functioning self like you were 20, 30 years ago, and have you smiling and looking beautiful.
Okay, what about diet? Does that have anything to do? A lot of people don't understand the connection. Tell us about that.
Well, good health starts with good nutrition. In order to heal properly, in order to maintain your smile, you have to have a well-balanced diet. If you eat a lot of acidic foods, that's going to compromise your periodontal health. If you eat a lot of candy or sweets, that's going to destroy the foundation, because they provide the bacteria, they provide the source that bacteria inside the mouth actually eat and destroy the teeth and the foundation and promote cavities. And that promotes, of course, pain, and that's usually what brings us to the dentist. Also, for the elderly population, I won't always say the elderly, because a lot of young people are starting to lose their teeth at an earlier age because of the lack of education and knowledge. We've had cases where patients have been in their 40s and 30s, and they have severe advanced periodontal disease, and they're losing their teeth at an early age. And for those people, you know, being able to eat is an issue, because if your teeth are loose and they're moving, or they're not properly restored at the right height, you can't chew, and therefore you can't masticate to be able to get the nutrition that the body needs to maintain its health. So having teeth that are healthy, having gums that are healthy, having a nutritious diet, all of that plays a part together in a cycle in terms of having good oral health.
Well, you actually help your patients with that, with the diet?
Well, I don't actually do. If they actually need dietary teaching, I would refer them to a nutritionist, where they could actually give them and counsel them on those specifics relating to their health. So, for example, diabetics, you know, they have to, of course, limit their carbohydrate intake and monitor all of that because of their glucose metabolism. But what I'm saying in terms of that is that for those patients, if their disease process is not managed appropriately, that's going to accelerate the problems that they're having in the oral cavity. So we have to be able to educate people, you know, about that aspect of dentistry. So yes, I do that as well. And I provide a lot of education in terms of just the multitude of the things that we do and how it affects them. For example, with wisdom teeth. We know that wisdom teeth, eventually at some point in someone's life, they will encounter a problem with one of their wisdom teeth. And a lot of that has been, it has been documented that the reason we're having more problems now, we talk to our parents and they say, well, I have my wisdom teeth and I never had a problem with them. A lot of that scientifically has been attributed to dietary changes. For example, we don't chew on a lot of hard foods. So we eat a very refined diet. So as a result of our diets changing, whereas in the older population they would chew, on chicken bones, eat nuts, and chew things that were really hard. So that would
Pig feet.
so that would stimulate the jaws to grow.
Right.
Because the more forces you put on a jaw, the more it's going to grow. So if those forces are restricted, then that's going to limit the growth of the jaws. Therefore, the wisdom teeth become impacted. They stay in there. And then that's when they become problematic. Because if a piece of tooth is peeking through the gums, you don't have the accessibility to keep it clean and free of bacteria. And they still travel underneath those tissues and can compromise the health and cause infection, pain. Several people end up losing their lives because of teeth, and I'm not sure if you're aware of that. But
No, tell us about it.
yes. Dental infections, I'm not sure of the percentage exactly, but I've had several cases where patients were admitted to the hospital for sometimes weeks on end because of dental infections. So when the body can no longer handle those bacteria, they become locked in and confined to the facial spaces, and they can travel very quickly. They can travel very quickly to areas underneath the neck, inside the throat area, and they can compromise the airway and become a serious morbidity issue. So it's very important, if you're not sure you have wisdom teeth and you're not sure if they're erupting in a pathological manner, it's a great idea to seek out your oral surgeon and have them take a look at it. And that's just one aspect of the oral health that we deal with.
Right.
But it can be very, very serious and also very detrimental. Another area that I would just kind of like to touch on that I think has not really gotten the recognition that it deserves, but it's becoming more popular now, is sleep apnea. Sleep apnea.
What sleep? What?
Sleep apnea. So basically, during sleep, there's either a cessation or an interruption in your breathing pattern. And as a result,
And your teeth have a effect on it?
well, not necessarily, but that's one of the areas as an oral surgeon that we deal with. We just don't deal with teeth. So remember I said it's the cranial facial structures that we deal with. And the oral cavity, your tongue, your pharynx, all of that can play a role in that. But with sleep apnea, basically a lot of the spouses or people who notice this from their spouses will say that the patient is waking up in the middle of the night, sometimes gasping for air. Sometimes they report heavy snoring. These people may have daytime sleepiness. They're falling asleep during the day because they're not sleeping, because they keep waking up because they're not breathing. And the sequela of not having this treated could be hypertension. They can end up with strokes, even sudden death. So if you're having daytime sleepiness, or if you're having these symptoms and your spouse is saying, hey, you're waking up and you're gasping for air and I hear you snoring and it sounds like you're not breathing during the night, you may want to talk to your primary care physician about having a sleep study. It's called a polysomnography. And then in terms of oral surgery, what we do, once the sleep study has been done and your diagnosis has been made, depending on what type of sleep apnea you have and how severe it is. So it can range from mild to severe. We can make devices for you if it's mild that will advance the jaw forward and allow you to breathe better. Okay, because
what type of device are you talking about? Is it a wire or just
no? It's a mandibular repositioning device. It's almost like a mouth guard. So it's a mouth guard.
Like the
sports guard.
Sports guard.
Yeah, we'll get into that shortly.
Yeah.
Yes.
Yeah.
But it's like a mouth guard, but it's made for the upper and the lower jaw. And basically it there's different types, but it has a locking mechanism where it can advance the jaw forward. So now when you advance the jaw forward, that opens up the airway and allows you to breathe better. That's one option. Now the other options in terms of surgery and what surgeons do, we also can do maxillomandibular surgery, orthognathic surgery, where we actually physically take instruments and actually make cuts in the jaw and bring the upper and the lower jaw forward to create space. And that's usually curative. That's like 99%, 98% curative for that condition. But that's usually only done in moderate to severe cases. ENT surgeons also do a lot of the other surgeries. The uvulopalastal surgery, where they can cut your uvula and kind of just redefine the structures inside the oral cavity. But it's very, very important, because a lot of people are walking around with this condition and they have high blood pressure and they don't know why. The first thing, if you're overweight and you're exhibiting these signs, is weight loss. It plays a big factor in helping to reverse some of these conditions. But first, you need to seek out your physician, seek out your oral surgeon, and have that conversation with them about some of these symptoms you may be experiencing, and you may actually have sleep apnea. Now I don't know if you have another question.
Now, it's something I'm sure that the people would like to know. What about mouthpieces that they start when a youngster is young? You know, he's playing Pop Warner football or
Exactly.
basketball. Just give us your opinion about those.
Okay.
And how they can be improved.
How they can be improved. Well, first we want to start off with just saying that more than 200,000 per year oral injuries are the result of oral facial trauma. And about 63 to 60%, 65% of those, according to the American Dental Association, are teeth-related, sports-related injuries. So how do we prevent this? We can prevent this, but we have to first be informed, okay? A lot of parents aren't informed about the sequela of a sports-related injury and the morbidity, the financial stress that it's going to put on a family when the child has an injury, and now you have to go and pay for a root canal to be done on a tooth that could have been prevented, or they have to place an implant. So when you look at long-term versus short-term, you're going to save more money by preventing these problems from occurring. And the way we prevent them, there are stock mouth guards, and then there are custom mouth guards. So stock mouth guards are made, you know, like you can get those at like Sports Authority and those kind of places. Those are not the best because they are not customized to fit the teeth exactly. So what we do is we take impressions and we make a mold, and it's an exact copy of your teeth. Of the individual's
Right.
teeth. And now we have the capability to make them in all colors. We can actually even put your logo. We can put your team logo on them. And it's highly recommended, again, because financially, if you look at the cost for a custom mouth guard, okay, versus treating a tooth that has been avulsed or lost in an accident, versus, you know, providing root canal therapy for that tooth. It's going to be a major savings in the short run, and you're protecting your child. And after 8 years of age, those two front teeth, those are their permanent teeth. So those teeth are not going to grow back again. So those aren't baby teeth that we're talking about when these children are playing these sports.
Right, sports, right.
So these are teeth that we can't replace. So we need to preserve those teeth. In terms of how we're moving forward, again, like I said, with the new technology, we can actually scan a patient with the 3D technology, and we can have a mouth guard fabricated, and it can be made within a week's time. And again, that custom aspect of it.
Custom aspect is very important.
Yes.
Well, Mark, tell us a little bit about getting this group together, since you're the Chief Executive Officer. Tell us about your job.
Well, it's a very interesting job, managing people and managing patients, and but it's actually fulfilling because I'm able to see people come into our facility and get treated with such care that Dr. Russell and our team offers. It's just really overwhelming to me that we've been able to achieve as much as we have in such a short period of time. But the Maryland Oral Surgery Group, you know, we're committed to providing quality care to our public, to our community, and we definitely want to, I think we want to be one of those type of institutions that educate people, as Dr. Russell said. We take great pride in people understanding exactly what's going on in their oral cavity. And actually, as Dr. Russell said, just not the oral cavity. Sometimes people will walk out of our office and they'll find out other health-related issues that their own internal medicine doctor might have not found out just because of how diligent Dr. Russell is. But as for my job, it's fairly easy. It's fairly easy. You know, I'm not
Dr.
the surgeon.
Russell, your wife, she has to deal with the yelling and screaming.
Yes, yes. She has to do all the
She
work.
has to psychologically. She has to work on
Exactly,
that. Yeah.
exactly.
Well, Dr. Russell, we have a display here. Tell us about this new gadget. I say gadget that you have here.
Well, first let's start off with implants. I mean, there's been a lot of talk in the media about implants. What are the indications for implants? And primarily, when we look at tooth loss, you want to say that maintaining your own natural teeth is always going to be the gold standard. So that is key. So when that cannot happen because of premature loss or because of age or, you know, caries or what have you, and you lose your own natural teeth, the next gold standard are implants. Now, some doctors don't advocate for implants primarily because of either lack of knowledge or they're not comfortable with placing implants. But implants are the gold standard. And the reason why implants are considered the gold standard is because, remember I talked about the forces that are being put on the bone? When you talk about placing implants, now you maintain that bone because it's the same concept as our muscles. If you don't use it, you lose it. So if there's nothing inside of the bone, either your own natural teeth or this titanium metal that acts as a root, the bone will eventually go away. It'll eventually go away. So
Disappear.
that's what you're finding with people who wear dentures. With dentures that are not retained by implants, you actually have accelerated bone loss because the forces of the denture are actually pushing down on the bone and actually making it go away. And because there's nothing in the bone, remember, because of there's certain cells we call osteoblastic cells and osteoclastic cells that basically form bone and destroy bone. Those cells basically can't function the same way they would normally work if there was something inside the bone like a titanium piece of metal. So this is one of our options that we provide for people who end up losing multiple teeth or lose an entire arch of teeth or who have dentures, especially if they're ill-fitting dentures. And we will find that the lower denture is the most commonly affected. And the bone loss acceleration in the mandible or the lower jaw is responsible for this. So we would love to have you start off with at least 2 implants. You know, 4 is ideal with this new technology where you've probably heard of it, I don't know, on Clear Choice. You see the commercials on television.
Yes, right.
Those are called teeth in a day. You do not actually get teeth in a day. There is preparation that actually goes into having those teeth fabricated before you get those teeth on that day.
They have to take an X-ray and then work from there, like
exactly,
a blueprint.
Exactly. There's a blueprint that's created before the actual surgery has been started. They kind of have a feel for where the implants are going to go. They actually have the denture already kind of prefabricated. So while you're waiting for your implants to heal, you actually have a temporary denture. It's not a permanent denture. And then after the implants heal and integrate into the bone, then you get a permanent device that's fixed and retained. Now there are some options for dentures where you're still using implants, but they can be snapped on and off. But for this example, this is an implant retained denture because this denture will sit on top of this, but it's screw retained. It's not something that the patient will be able to take in and out of his mouth. He will have to have it removed professionally by the dentist to have it cleaned.
Oh, I see.
Now
You can't take it out and put it in a glass jar, you know, water, then put it back in.
Right, but there are other options that can be cheaper options, but it's still an alternative because you still get implants where you have fewer implants and you use locator attachments and the denture can actually snap onto those and the patient can actually remove those devices, but it's still a more stable situation than just having a denture just sitting on a ridge, okay? And if you want to maintain that youthful smile and that youthful appearance and not have that aged appearance, this is the
Just-
way to go.
That's the way to
with
go.
implants.
Tell us, give us some idea of what you actually think that an individual should do to keep their teeth. You know, preventive measures.
So preventative measures for maintaining oral health, of course you want to visit your doctor, your dentist every 6 months. So from the time you're small, if you have small children, according to the American Academy of Pediatrics, you want to start having these children see the dentist when they first get those teeth. So they actually say 1 year of age. So usually those teeth come in when you're about 6 months old. So that's when you want to start having these children visit the dentist when they're
When they're
one
1 year old. You heard it here on the Ed Brown
Right,
Show.
because
They're
they-
1 year old, and you gotta get them to the dentist. You know,
Right.
Because it's so very important. Preventive measures. Okay, taking care of the teeth. Give us some.
Okay. So what you want to do
You
in
brush 3 times a day, or that's the end of it? Or what?
That's great. 3 times a day is great. At least we want to have you do it at least twice a day. Twice a day, at least morning and night.
After each meal.
After each meal would be great, but you know, the requirement is usually 2 times a day, and we want you to floss daily because you got to remember around each tooth there is an actual collar. So around that collar, that's where the food and the plaque will actually collect. So if you're not flossing, you can't reach those areas. Your toothbrush can't get into those complicated spaces. And that's why it's important to then follow up with your dentist every 6 months, because he or she may advise you at that point in time that we have to do some deeper cleaning into those pockets to get those extra bacteria out. And those bacteria are the bacteria that will actually compromise the periodontium or the periodontal or the bone structure that will actually accelerate that bone loss and cause premature loss of the teeth.
Great. You've heard it here on the Ed Brown Show. This is the first time, and I think you got some very, very good information here. And I want you to tell your friends about this Maryland Oral Surgery Group that's in this Washington, D.C. area. So when you need or you have a problem, this is the group, but they have everything to help you with your dental problems. Okay, this has been Ed Brown. See you next time.